The center was created and formally announced in June of 2021, and it began really as the brainchild of our dean, Dan Clay, of the College of Education.
During COVID, the additional stresses on mental health really became kitchen table conversations for the first time, and we were well positioned at that time to provide services and additional help around the state in mental health. So working with the State Department of Ed, we developed a center to address the problem.
The key objective of the Scanlan Center is to serve as the state's hub for school-based mental health services. And so with that, we are really aiming to improve the social, emotional, behavioral, and psychological outcomes of both students and educators.
Mental health is actually just one part of a larger spectrum of well-being. And so while we talk about mental health as being the thing, mental health is often sometimes the outcome of something else that's not going well. There is research that says that if students slept better and more consistently, 30% of them would stop going to counseling immediately. And so while we look at mental health as the issue, sometimes mental health is the outcome. And people just need to sleep better, eat better, socialize more regularly, exercise, and those kinds of things. And so we're seeing sort of the growth of a larger well-being perspective on campus, and that's a really cool, exciting thing to be part of.
A couple of our key clinical services at the Scanlan Center for School Mental Health Clinic are short-term individual and group therapy that we provide to the K-12 population of students as well as educators, and then offering post-crisis debriefing and support, so we're able to go into schools following a crisis event, work with the crisis team that's on site to provide some ongoing support to the school staff and the students. The goal of the clinical service arm of the Scanlan Center for School Mental Health is really to reduce barriers to accessing mental health treatment, to then support the mental health needs of K-12 students and educators across the state.
The learning and training opportunities in the center are abundant. We have anywhere from asynchronous modules that educators can tap into for free. There's a series of 18 different modules that focus on various topics related to school mental health and educator and student wellness. We have different types of trainings, certified trainings, things such as youth mental health first aid, teen mental health first aid, QPR, question, persuade, refer. It's a suicide prevention, postvention training. And then we also do individualized plans for schools.
One of the goals of our center is just to create a bigger workforce of trained professionals in the mental health fields that will go work in our schools and in our agencies in our rural districts, especially where they're mostly underserved.
I think our center is unique in several ways. We provide professional development, research, training, and clinical services. A lot of centers across the country maybe do one or two of those things, but we do all of them.
It's all about interdisciplinary collaboration. We have individuals that have expertise in public health, in school mental health, in psychiatry, in education, in social work, in school nursing. So trying to get all of those partners at the table. So we're trying to identify what works best, what is effective, what is a good use of our time and skills, and also what can be replicated. So we can give to the schools and say, hey, this is pretty doable and it has pretty good outcomes. Here, you go and run with it. So I think that's why it's important to actually test those interventions in real schools.
The future of the Scanlan Center is bright. As we become more well-known across the state, we have more and more people asking for our help and our services. And so I think that's what's really exciting, is the opportunity to serve the state in a way that it hasn't been served before.